Stroke is the fourth leading cause of death and the leading cause of long-term disability in the United States. On average, someone has a stroke in the U.S. every 40 seconds.
You can remember the signs of a stroke using an acronym FAST, and what that stands for is a facial droop, a drift in the arm, a change in the way you speak, or difficulty finding words. If you notice your loved one having any of the signs of a stroke, you should call 911 immediately because time is of the essence. Time is very critical if you're having signs and symptoms of a stroke, because for patients who come to the hospital within the first 4.5 hours of stroke symptoms, we have an approved therapy that can be given intravenously that can reverse their symptoms in many cases. Most strokes occur in middle-aged to elderly patients, and in this age group, the primary risk factors that contribute towards a stroke include high blood pressure, diabetes, high cholesterol, smoking, and an irregular heart rhythm, or a rhythm called atrial fibrillation.
While 3/4 of strokes happen in patients 65 and older, strokes can and do happen in younger people.
A significant proportion of strokes also occur in the younger population, but the risk factors in this age group are different, and they can be anything from cocaine abuse to a tear in your blood vessel, a condition called dissection, or to a tendency for your blood to thicken up and form clots. So controlling your blood pressure, quitting smoking, keeping your diabetes under control, taking your medications regularly for heart failure, knowing your cholesterol value and making sure it is under control are important steps that you can take to prevent your stroke risk.
Sinai-Grace Hospital is a stroke-certified center with an emergency stroke response team available 24 hours a day. Sinai-Grace also has an outpatient stroke program in the professional office building.
Sinai-Grace Hospital has been certified by a national body called the Joint Commission based on strict standards for quality of stroke care offered at this institution. The outpatient stroke program at Sinai-Grace Hospital focuses on prevention and recovery from strokes. So a stroke specialist evaluates a patient with a stroke and determines what the underlying reason for the stroke was, and that helps us design appropriate therapies to help prevent future strokes. They also identify disabilities that stroke victims have to help them work with those disabilities so that they can integrate back into society. Part of the Sinai-Grace outpatient stroke program is also stroke prevention. So patients who have a number of the risk factors that we mentioned earlier can get a consultation with a stroke specialist on ways in which they can reduce their stroke risk. The outpatient stroke program at Sinai-Grace also sees patients who have had brain hemorrhages or brain aneurysms. So if a patient has long-standing headaches, or if they have a family history of aneurysms, they should consider getting an evaluation at Sinai-Grace's outpatient stroke program.
If someone is having a stroke, call for help or 911 immediately. To learn more about Sinai-Grace Hospital's outpatient stroke program, call 313-966-4800.